Oftentimes when we go to a doctor or a doctor's appointment, we get 5 minutes with the doctor. We already did our pre-blood work. They come in, they look at the chart, they say you're fine, you're healthy. Yet I'm 40 pounds overweight, I'm completely miserable, I want to cry in your office, and I'm terrified about going outside and getting in my car and going back to a life of pain. You know your body, and you know that something is wrong, even if the physician doesn't think that there is. You know something is off. You know something's not right. You know you didn't feel this way a year ago, 5 years ago, 10 years ago, and you have to be your own health advocate. However, you also need help. When we do blood work in medicine, there's a little range over here. Here is your result, and here is the range of the average population. And if you fall in that range, you're good, you're healthy, nothing's wrong. That is not life, and that's not what happens in practice. And I often tell my patients this, even though you're in range, even though the lab says nothing is wrong, what I hear, what you're telling me is that you can't trust your own body, you don't feel comfortable in your own skin, you have a horrible relationship with this person or that person, and something's not right. So there is an art to that in medicine. It's not just about this lab range that you have to fall into and then you're normal. It's about optimizing you to a place that you feel the best version of yourself. And that comes with just talking to you. That comes with you and me as a team working through what is the start of your health? What is the thing getting in your way, first and foremost? And almost always, I'll tell you, it's a mental, emotional thing first. And we have to work through those things. Oftentimes, though, we're working on your blood pressure first, we're working on your hormones first, but those things take time. They take time to work through and for you to even understand. And that's a difficult thing to uproot at the same time. But all you know is that you're not right. You don't feel right. So it's important that you come to a physician, you come to any health provider that understands that your body can heal. Your body is all-knowing and it does have those fundamentals to heal. But you also have a role too on giving your body what it needs and thinking the certain thoughts and saying that I'm in pain, I need to get out of pain. I need something to change. And that just takes some time. That takes some time and that takes some reflecting. When you come to see me, I'm not going to tell you what's wrong. You're going to tell me what's wrong. You're going to tell me what you don't like, what the issues are. Oftentimes I can hear what the true root of that is, but it does us no good if I tell you, oh, do this, take this medication, take that cream, do this, call me tomorrow. That's not healing. You have to get there, and you have to then come to that realization, and we come to that realization as a team that, you know what, I think the reason my cortisol is very low is because I have a really bad marriage. I have really bad communication issues. I'm really hard on myself. Or maybe I just don't take 1 minute for me when I get home. I'm always going from one thing to the next thing. So you know what's wrong. And when we get through that together, when we figure out the best thing, natural or not natural, then we come to a place of balance, we come to a place of health, we come to a long-term health that we're striving for. you.